All right, so this will be the end of the physiology talks about respiration. And so we want to cover some disease processes, some homeostasis and homeostatic imbalances, things that can go wrong, and that'll be it for respiration. All right, and so again, when you do acid base, we'll review a little bit of respiration, but it'll be in terms of acid base balance. Okay, so this is it for respiration. So one thing you may have heard about is called a collapsed lung. All right, and the fancy word for that is atelectasis. So it's a lung collapse, and it can happen for various reasons. It could be a plugged bronchiole. So if the bronchiole is collapsed or plugged, then the air can't get into the alveoli, cause the alveoli to collapse. Also a pneumothorax. So that would be like a hole in the chest wall that admits air, so that now the air pressure is much higher than the pressure inside the pleural cavity and kind of causes the lung to collapse. So like a gunshot wound or something like that can cause a pneumothorax. There are also things called spontaneous pneumothoraxes where there's not an actual hole from the outside, but there's just a hole in the pleural cavity wall. You'll see that in typically tall, thin Caucasian males who will have these spontaneous pneumothorax. We have something called COPD, and I know you've heard about that on the TV and thought, wonder what that means. It stands for chronic obstructive pulmonary disease. So COPD are things like chronic bronchitis and emphysema. And these are irreversible diseases, and so it's an irreversible decrease in the ability to force air out of the lungs. And so if someone has COPD, what you typically see is someone who has smoked. They have labored breathing, which is called dyspnea. Some of these words are hard to say. Like coughing, frequent infections. Typically they have respiratory failure, which is called hypoventilation, accompanied by respiratory acidosis. So they would go into the hospital, they'd take a blood sample, and they would see that their pH of their blood was too low. And we'll talk again about respiratory acidosis versus respiratory alkalosis when we talk about pH balance. But COPD is a common thing that you see. So here are differences between bronchitis and emphysema. They both can be caused by tobacco smoke and air pollution. So if you live in an area that perhaps uses coal for energy, and so when they burn the coal, it puts off pollutants, that can add to that. If you live in real smoggy areas, lots of traffic, so anywhere there's high air pollution, you can see increases in things like chronic bronchitis and emphysema. You can also see a lot of asthma in places that have a lot of pollution. So what you see is with this smoke and air pollution, it's going to go into your lungs, and obviously the cilia and the things that sweep out the mucus and the dirt from your lungs just can't keep up, and things get trapped down in the lungs, and it causes continual inflammation and irritation. And if that happens, you get chronic bronchitis, which leads to edema, which is swelling. It leads to a cough and bronchospasm. If you have the result being a breakdown of elastin, and this is going to happen if you also have a deficiency in alpha-1 antitrypsin. So your lungs are no longer elastic anymore. And so in this case you have emphysema, and that is going to cause the alveolar walls to be destroyed. The lungs are not elastic, and the air gets trapped. You can't blow it out. So in either case, you wind up with airway obstruction or air getting trapped. You have that dyspnea. Frequent infections. You have abnormal ventilation to perfusion ratios. You're hypoxic. You have hypoxemia, hypoventilation. So a lot of times, they may even have a blue tint. They're just not getting enough oxygen in. They're just not able to breathe real well. So chronic bronchitis and emphysema. Another one will be asthma. I've talked a little bit about that. And asthma usually is in response to something inflammatory, some kind of immune thing like an allergy. So you have coughing, dyspnea, wheezing, maybe your chest feels tight. Typically when you have an asthma attack, something has kind of triggered you, kind of caused this asthma attack, maybe whatever your trigger is, be it pollen or dust or tobacco smoke or something, causes your bronchus to spasm. It's going to clamp off, make your chest feel tight like you can't breathe, and you really feel like you cannot breathe. And it's usually going to be just an over-exaggerated immune response. So you're going to take a breathe of an inhaler like epinephrine that will open up those bronchioles and allow you to breathe if you're having an asthma attack. Typically you'll see a lot of thick airways with a lot of exudate, a lot of mucus and things like that. So people have to take breathing treatments to try to keep their asthma under control. They also learn to know what might set them off and try to avoid that. And keep an inhaler with them, an emergency inhaler, in case they get caught and need to do a puff and open up their airways. Some people get exercise asthma as well. And so sometimes an inhaler will help them as well. If they get too hot and exercise too much, they feel like they can't breathe, and so an inhaler can help exercise-induced asthma as well. I'm going to use tuberculosis also. This is something that several years ago I might not have included because we really didn't see a whole lot of TB here. But now, as we're having changes in immigration patterns of people coming up from Central and South America, you're seeing some more tuberculosis where it's more endemic. And so we used to not see it as much. Well, we used to see it a lot, and then it kind of disappeared, and then it's kind of coming back. And so TB is based or caused by a bacteria called Mycobacterium tuberculosis that gets into your lungs. And it can cause fever and night sweats and weight loss and a really bad cough and hacking up of blood. And it can take up to 12 months to treat it with antibiotics. And you can just see it really just ravages your lungs. So that's why you get a TB test to see if you're a carrier or been exposed to tuberculosis. It's highly contagious, so sometimes they have to put you in an isolation ward to treat you for a couple of days with antibiotics, and then you're able to go out once you're no longer contagious, but you still may be on the antibiotics for a long, long time to get rid of it. It's kind of tough one to treat. A lot of times they'll do an x-ray in order to diagnose TB. And that's the one you get your skin test when they prick your skin to see if it bubbles up, to see if you've been exposed to TB. Lung cancer, that is the leading cause of cancer deaths in America. It's almost 90% of all cases are due to smoking. So the best way that you can improve your life condition and reduce your chance of death to many, many, many preventable diseases, including heart attack and stroke and cancer, is simply to quit smoking. And that includes secondhand smoke, so you want to have your partner, your parents, convince them to quit smoking as well, because that secondhand smoke can also affect you. There are 3 types of lung cancer. You have squamous cell, which is going to be in the bronchial epithelium. That's about 20 to 40%. Adenocarcinoma, which is going to be in some glandular tissue in the lungs. Small cell carcinoma. This is the one that's most likely to metastasize, so it's kind of, if there's a good and a bad, I would say this is the bad one. And so you don't want small cell carcinoma because it tends to spread. Just to go back, because we always want to make sure we're thinking back to development, because we've talked about pregnancy and we've talked about fetal circulation. So remember, in development, when the fetus is inside the uterus, it's using the placenta as its lungs. Okay, so gas exchange is occurring in the placenta in the infant. So remember, the blood is going to leave the umbilical arteries and veins, go out to the placenta, and this is where gas exchange is going to occur. So if you don't remember your fetal circulation, go back, because I kind of expect you to remember that, because we've talked about it before. Because of the lungs in the fetus, they're filled with fluid. So you're bypassing the lungs while the fetus is inside the uterus. So go back and think about those bypasses too. So anything that you've learned previously related to that is still fair game. So go back and remember your bypasses and your fetal circulation, because again, it's very important when you think about respiration that the lungs aren't doing anything in the fetus, but the placenta is acting as the lungs. Now, if a baby is born prior to 28 weeks it's probably, it may not make it. We're getting better. We're pushing that premature birth rate further and further back to, even maybe down to 24 weeks in some cases. But the problem is they're just simply not developed enough. Now, after 28 weeks, if a baby is born, it can breathe on its own. It may need to have surfactant, and it still has a long way to go. It's still not out of the woods. It's got a lot of can have a lot of problems. It needs to be in a NICU, a NICU, neonatal intensive care unit. But again, a baby at 28 weeks should be able to breathe. Before that, 27, 26, 25 weeks, it's going to have to be on a ventilator. So again, as you push that premature birth number to lower and lower weeks of gestation, you have more and more issues you have to deal with. So if you can get to 28 weeks, at least the baby should be able to breathe on its own. All right, and just a couple more things. When you have birth, so when the child is born, that's when the respiratory centers are activated. They don't really breathe inside the uterus. You don't see their chests kind of inhale and exhale. They don't have to breathe because the placenta is doing it for them. So at birth, they take that first breath, the alveoli inflate, and the lungs begin to function, okay, because the respiratory centers are starting to activate. CO2 levels are building up because the placenta is not taking the CO2 away anymore. So that drive to breathe is going to happen. They're going to breathe faster as newborns, and then it slows down through adulthood. So you'll see, newborns, they breathe really fast, but they start to slow down as they mature and get older. The lungs will continue to grow and mature and get more alveoli until young adulthood. So around, mid-teenage years, your lungs are about as big as they're going to get. You've got as many alveoli as you're going to get. And as always, nothing good happens getting old. Respiratory efficiency decreases. Lungs become less pliable. The cartilages in your costal cartilages, for your ribs and your thoracic cage, become less pliable. It's just harder to breathe. So things just tend to go down, as is the case with everything in A&P. Nothing works better as you get older. And that's it. All right. So that's it for respiration, and have a good one.